How do people like yourself, Colleen, um, in academia or in um, the nonprofit world or in government, how can the policies be changed with regards to this issue of vaccination, specifically vaccination when it comes to COVID? Because this isn't some issue, like some distant issue that we can talk about and hope that that governments change their policies on. This is something that's urgent, and if it could eventually become, if we're going to talk ideologically, right, in terms of like the way that governments, or the manner that governments speak, and the lingo that they understand, it could become a national security issue. So what is the, in your mind, like the best way to approach this to actually change policy?
So we approach it, so public health in a pandemic has obviously been like elevated as a field and a discipline, which is good and bad. So it's bad because I feel like the communication around the public health communication around the COVID-19 pandemic will be studied for decades, if not a century to come, because there was many areas of it that were severely flawed. The benefit is that many in my department and my school and myself included have had the opportunity to be involved in, as cheesy as it sounds, highly effective task forces that are involved in decision making around these things. And so with direct lines to decision makers and policy makers on the sort of forefront of the decisions that you see out of, the White House, the CDC, and things like that. And so even we've written, for example, numerous letters that have gotten quite a bit of media attention, and then ultimately the attention of government officials, for example, around the Title 42 that I mentioned, with using public health, like ill-informed public health guidance to shut down the border to asylum seekers, which is required by international law. We've also, for example, pushed for vaccination, equitable vaccine distribution globally. And so those things, like signing on to those things as academic leaders in the public health space, actually has an impact when you have a collective sign on of several hundred people, including deans of your major schools of public health. And so these are ways that we've been able to push forward some of the policy decisions that we want to see. And also, a lot of the faculty of schools of public health are on the decision-making teams or the task forces or the policy-making groups that are like actually making these decisions. So sometimes it's a matter of finding the right person and just being like, hey, we should really not let millions of doses of vaccine expire at the border. That seems like a really poor decision. So there's people, for example, that I know that are specifically working on that issue to prevent that from happening. And so we hope that it changes things by the end of the month.
I don't think anyone from the public health community or the medical community would disagree with you. I mean, it's politics. It's purely bullshit politics that are getting in the way of something that should just be a purely health situation. And it's like, if we can, raise taxes on tobacco and, make other public health situations, which I'm not a fan of the taxes on tobacco personally, but that's my own vice.
Sounds like a personal issue.
That's a personal vice. However, if we can get those things done, we can get vaccinations, and we need to take the politics out of it. It needs to be an apolitical issue, and just, it's science, it's health, it's for all of us.
I agree completely. I think that it was this pandemic and the response to the pandemic was politicized early on because of the previous administration. And unfortunately, that has just snowballed, and every public health decision has become a political decision on the right and the left. And it's really been sad to see, honestly, because I think lives are lost as a result.
I mean, I think we can without qualms point a finger at the Republican Party in the United States, and it's infectious, because you see, like, we're seeing mimic behavior in other countries, and like Bolsonaro in Brazil playing the Trump game, because they saw how it worked, and it was successful, to a large degree. So you see regimes sort of copying that and turning everything into some kind of political issue, when really it shouldn't be a question.
No, the border closures, the nationalist sort of approach to governance, and the far right-wing movement around the world it's all reflective, either informed the Trump administration or now really reflects it as well. And so it's terrifying for anybody who is a person of color, is of a minoritized group, is of any sort of non-majority status. It's actually terrifying to move towards that form of governance on a global level.
Or if you just give a crap about human rights.
Right. Yeah, exactly. Exactly. If you care about people and one another and the rights of those people, then you should be really alarmed. And that's why a lot of my work falls into what's called like socio-political determinants of health, because I'm constantly thinking about these larger scale governance issues and trying to raise the red flags about, hey, we should all be worried about these trends, like look how damaging they are, and it's not just here, it's all over the world.
Mm-hmm. And instead you have dumbass Republicans like just spouting nonsense. And I mean, like, I'm not saying this as someone who cares about the Democratic Party either, because they don't impress me that much, but the Republican Party has become very malignant and
disturbingly so, to their own demise, to their own detriment, to their own mortality. Like it's bizarre. It's completely bizarre.
Denying science, denying logic, and even when it's against their own interests.
Yeah.
So, well.
Yeah.
So you want to weigh in on that?
I mean, I agree. I agree completely. I couldn't say anything different. It's pretty shocking what's been going on, and yeah, it doesn't make any sense logically in any way, and it, like as you put it, Goleen, for someone who is of a minority background, it is terrifying. Yeah, that's a very, very good way to put it, just to see all this nationalism everywhere. But yeah, we could go on for hours. There's so much to talk about.
But I think anyone with a sensical mind would not disagree with us. We are winding down.
Yeah.
I think we've covered a lot of good territory here.
Do you have any final questions?
We could question you for for another like 2 hours, but I don't think that this session
it'll drag a lot.
Like,
so
we gotta portion this thing out. So
sense.
we don't have enough room in this session, and we have about 1 minute left before it's going to time out on us anyway.
Awesome. Well, thanks for having me. It's been a pleasure talking to you both, as always.
Thanks, Goleen. It was really great having you.
Of course. Of course.
Dr. Sabzi. It's nice.
Yep.
It was nice to see you.
You too.
Maybe we'll talk again soon.
Definitely stay in touch. Send me good vibes as I enter parenthood.
I'm
Good
sure you'll
vibes
be
sent.
just fine.
Yeah,
Thank
no,
you.
you'll be great. You'll do great.
All right.
Thank you. All right. Talk
All
to you
right,
both
talk to you.
soon. Bye.
Talk to you later.
Bye.
Bye.
Everybody.